Good afternoon, everyone. Thank you for joining us today for Community Conversations. I am Talitha Coggins.
And good afternoon, everyone. I am Fatmata Williams, a Win TV board member and also a Windsor resident, and it's great to be here with you today.
Yes, it's wonderful to be back. The last time we spoke, we talked about managing type 2 diabetes. And so this is our second conversation of many more to come. Today we are here to talk about Black Maternal Health Week, which is April the 11th through the 17th. It's held annually. And this is a week-long campaign that was founded and led by the Black Mamas Matter Alliance, right, Fatmata?
Absolutely.
To build awareness, activism, and community building to amplify perspectives and lived experiences of Black mothers and birthing people, right?
Absolutely, and also to get legislators to act, because remember, it was supported by the Black Maternal Health Caucus, right? So Representative Alma Adams, then Senator Harris, Representative Lauren Underwood, and Senator Cory Booker of New Jersey. So they, worked with the Black Mamas Matter Alliance, because Black Maternal Health Week had been celebrated since 2021. However, in 2023, April 10th, the Biden administration then put it, into a legislation that we have to, recognize the week.
Right. Yeah. And in addition to that, what's so, significant about this week is that it also occurs during National Minority Health Month, which is also this month in April, and it raises awareness about the importance of improving the health in racial and ethnic minority communities and reducing health disparities.
Absolutely.
Right? So
Yes.
that's also wonderful that this is intentionally situated during this month. So we are here to talk about Black Maternal Health Week. Fatmata, I've known you for many years, and as long as I've known you, you have been a staunch advocate. You've been so passionate about maternal health, particularly Black maternal health. Can you talk a little bit about why that is?
Absolutely, Talitha. And yes, I am passionate about maternal health overall, but especially Black maternal health, because I come from a personal place with it. And, I made the connection to the larger picture years ago. So in 2005, I was pregnant with my second child, healthy pregnancy all throughout. Then I went to have my son in a hospital. And everything went all right at that point in time. But for the intervention of God and my obstetrician and a nurse who was just very astute, I would not have been here. And probably my son would not have been, the 19-year-old person that he is today, right? And then in 2008, my younger sibling, similarly situated, a healthy pregnancy, went to deliver her baby in New Jersey. She had the baby. But then she died 30 days after that, after she had had several interactions with the healthcare system. Marie died, and she's not here today to tell her story. And that had been on my mind that, just something is not right. But then in 2017, one day I was driving home from work, and then I heard on the National Public Radio, NPR, I believe it was on All Things Considered. Anyway, one of those shows. And they were talking about the lost mothers. They had a series called The Lost Mothers. Why are so many Black women dying? Well, that piqued my interest. It was then that I heard about a lady by the name of Charlon Irving, who died similarly situated like my sister. She died just after she had her baby. It wasn't even 30 days after, from complications related to hypertension, even after she also had had interactions with the healthcare system. What was unique about Charlon's story is that Charlon worked as a decorated officer at the Centers for Disease Control, in the office that actually works on health disparities. She was a decorated officer. She had two PhDs, very educated woman. was up on the socioeconomic scale, and she had everything that you would say going for her.
Yeah.
But she still died. And so for me, that was the turning point. It was the revelation that there's something else going on here, that this woman would die in a similar fashion, and this stuff had been in my head for a while. That was when I decided that I will not stay quiet. I will do whatever it is that I can to not only work to improve it, but to also, raise the awareness and call people to action.
Thank you for sharing your story, and my condolences.
Thank you.
Again, for the loss of your sister. I'm glad that you are still here. Your children are still here. Your sons are here to raise awareness around this issue, to talk about it, to share with our community what this is about and why it's so significant, why it is so important. And so when we talk about maternal health, it refers to the health of women and birthing people. Can you talk a little bit about birthing people, because that might be a term that may not be as familiar with people?
Absolutely, Talitha. So birthing people or birthing persons is a term that's evolving to be inclusive. Not everyone identifies as a woman. I know for most of us, we're comfortable using the term, but for me, I vacillate between, birthing people and women, but just for the audience really to understand, or the community to understand, that in our effort to be inclusive, which we all should be, is to make sure that everyone feels included and as a part of this conversation and a part of the process. So that's why we use birthing people or birthing persons.
Right. Thank you for that clarification and elaborating on that term. So, again, when we talk about maternal health, we are referring to the health of women and birthing people and the comprehensive array of services that address not only physical health, but also mental health, right? And these services, they're received before and up to 365 days post-pregnancy. So at the top of our conversation, Fatmata, I shared the significance of Black Maternal Health Week, specific to advocacy and increasing awareness of the lived experiences of Black women and birthing people, right? But let's go a little bit deeper. I think that it's important to level set for individuals that may not be aware of this topic or that are yearning to learn more and have tuned in today for that purpose. So when we say Black maternal health, what do we mean by that?
That's a great question. And I write. I have a blog.
That's right, you do.
I write.
You do.
And in 2018, I wrote about maternal health, and I remember, I believe the first few sentences I said, unless you're pregnant or you work in the health field, this is not something that you will consume yourself with, right? So, however, these days we have to consume ourselves with it, because the United States is a wealthy nation and is among the most high-resourced countries in the world. However, even with that accolade and, placing ourselves on, so high on the world stage, we have the highest maternal death rate, meaning women who die, birthing people who die during pregnancy, all the way to 365 days after they deliver. We have the highest rate compared to all the other high-resourced or high-income countries in the world, number one. And then number two, in the United States, Black birthing people, women, and people of color die in desperate rates, more so than their Caucasian counterparts or any other race and ethnicity. So there is a stark difference. So that's the reason why we are calling out Black maternal health. And Talita, I'm going to use this analogy for you. It is not mine. I heard it somewhere, so I don't know who it belongs to, but I'm just going to say it is not mine. If you walk down the street, let's say you walk down a cul-de-sac, and there are like 6 or 7 houses, and there is a house, one of them is on fire. That's the house that you're going to focus on. So as I sit here with you today, as I'm this strong advocate that I am today, it is not that I don't care about all the people, all the birthing people that are dying. I do. One is plenty. What I'm saying is, so even if I have to think of a data off my head, I believe the maternal death rate in 2021 for the United States was 32.9. For white women, it was 26.6 per 100,000 live births. For black women, it had gone up to 69.9 or 69.4. Please fact check me if you need to. But that's how high that is. And it had crept up over time. So I'm just giving you the most recent one that's out there. It's at the CDC, the Commonwealth Fund, all of them have this information, right? So hence the focus, hence the push, hence the legislators, hence the maternal health blueprint, hence the CDC hear her. There's a lot of national attention, local attention, and I think we need to also bring this to bear in our communities for them to know what's going on. So you don't necessarily have to have someone who's pregnant in your family for you to really care. Right? So we're just trying to raise this attention here.
Yeah. I think that analogy is so perfect, right? Because you can just visualize that if there is a burning building, right, you will run to that building with water to attempt to put the fire out. You won't go to the house that is not on fire or has, any threat of harm or smoke or what have you. You're going to try to put out the burning building. So that is perfect. That is a perfect analogy to use. And I think what also is important that you said is that, we're talking about Black Maternal Health Week, and we are not, anti-Caucasian, anti any other race or ethnicity. We are specifically calling out Black maternal health because of the disparities, because of the outcomes, because of what the data has shown and continues to show as it relates to the Black community, the Black population, correct?
Yes, absolutely.
Okay. And additionally, one of the stark differences, obviously, is race. And we do know that race is a social construct, right? And so embedded within, those disparities and adverse outcomes that we are seeing in the data that you've referenced, are the ongoing effects of institutional racism that began with the enslavement of Black people. Okay, but to truly address those disparities, we have to take a look at it, right? And then we have to work together to dismantle those policies that give life to the practices that then breathe life to the outcomes that we're seeing in the data as it relates to the Black mortality rates, right? So in addition to that fact in terms of policies and practices, and we know that there's racism, systemic, institutional, those pieces that impact this, there's also bias, right? And I know one term that you use most often when we're talking about this, particularly in the healthcare field, is the personally mediated bias. Can you talk a little bit about that?
Absolutely, Talita. You talked about structural, you talked about systemic racism, and those are all valid, right? Because in terms of the structures, that's how people access resources.
Correct.
So when you have structures in place, people don't have access to what they need to. And I'm going to go far, whether it's education,
right,
whether it's a good job, whether it's moving from the, education to the prison pipeline. So there are a whole lot of things that the structures and the systems themselves create. But we cannot not highlight personally mediated racism because it is also rooted in those systems and structures. And you did highlight that race itself is a construct. It is a social construct. And I dare say that it is a way that resources are allocated, whether we like to acknowledge that or not, right? So when you have the personally mediated stuff, you have people who have grown up in these systems and they see things one way. There's substantial literature out there that shows that personally mediated racism impacts maternal health outcomes for Black birthing people. And it's not necessarily overt. So no one goes, Talita, you're a social worker, you're a clinician, I've been a registered nurse for a long time now, an advanced practice registered nurse. No one goes into the health profession to do harm. Well, let me say most people do now. We've seen movies where some nurses feel like they can take people out, right? But
most people do not.
Most people do not go into these helping professions to do harm. The doctors will take the Hippocratic Oath. The first thing is do no harm. The nurses, we have the code of ethics to go by, and there's what's called non-maleficence, means do no harm, or beneficence, do good. Do good is active, right? And then you have the do no harm. So we all have good intentions.
Correct.
However, if there is that thing that you're not aware of that determines the type of assessments that you do to Talita when she walks into your office pregnant, and you begin to judge her right from the get-go just because of how she looks, that can determine your attitude towards Talita. If you're not aware of the driving force behind that, that could determine the treatment choice for Talita. That could determine when Talita come to you with just this malaise or just this non-specific chest pains. Oh, it's nothing, just go home. That could determine you admitting her overnight just to monitor, even though there's nothing specific that's showing in the test results. But just Talita saying, I just don't feel right. That's what happened to Shalon, and that's what happened to my sister Marie. I wish there was someone who could just see something and say, you know what, no, we need to keep you overnight, right? But sent them home with scripts, and they died back on the way to the hospital. So nobody is going in there to do harm. It's not intentional. So which is why we need to highlight it. And no one is saying that this is the entire reason. It's not, because people go into pregnancies and they have complications. People go into pregnancies with underlying conditions. But even with all of that, if you pay attention, if you understand and you respond to me quickly, it doesn't have to get to that place where it becomes a complication that either leaves me, physically or mentally disabled or dead. Is what we're saying. And so in terms of implicit bias, it is something that we really have to pay attention to make a difference, to just make the difference between the rates, to close or eliminate the disparities.
Yeah, correct. And we all have bias.
Absolutely.
Right? We are not free from our biases, and that's why it's just so important, particularly in healthcare, but not only healthcare, and in life in general, that we are checking our humanity, right? That we are checking our biases. And in the healthcare field, there are different tools, right, that people can take. I think it's harvard.edu. What is that? I'm going to go take a step back.
I'm going to take a step back because I think you just touched on something.
Okay.
So, yes, we all have biases. And what you just highlighted, I want to tell you that there are prevalent biases in healthcare, right? Age is one of them, right? Your sex, your gender,
right,
is another one. Your sexual orientation, LGBTQIA community, that's another one. Your size could be another one. The type of illness that you have, mental health, substance use disorders. So those are all prevalent biases in healthcare, and I am not going to take out race. Race is a big one. And I want to touch on, so while all of those biases exist, we cannot separate people. So there's what's called that intersectionality, meaning how you come is how you come. So Talita, I cannot just look at you and say, oh, she's a woman. No, she's a black woman.
I'm a black woman. Exactly. Can't separate the two.
You can't. So we have to take all of those intersectionalities into consideration. And yes, there are tools. There are tools that one of the ones that used all over is called the implicit association test, where it's out of, I believe there's a link, it's out of Harvard. You can go and click on that link, and even if you just do implicit association test on Google, it's going to come up, and you will see a whole lot of assessments that you can take. And basically what it does, it associates your thinking through certain words, thinking that leads you to certain stereotypes. That's what it's going to look like. And it's going to give you a score. And the score is going to tell you, well, Talita, you're biased against people who have pets, or Talita, you're biased against people with substance use disorders, So again, it's a good thing for you to know, what your biases are, but what good is it for you to just know and not be able to do anything about it, right? Because what that leads, again, this is all in the literature. And I'm talking a lot because, Talita, this is work that I live, this is work that I've done,
I know.
This is something that I've experienced. So you basically, not only do you need to know, because awareness is the beginning for change, but there are things that you can also do. So providers who are aware and don't have the necessary tools to really address it may tend to avoid the particular population, because they're afraid to have those conversations. So there are things out there in the literature that you can use, mostly cognitive skills that you can use, and having open and honest conversations with your patients, because there's a distrust. There's an existing distrust, and this has been there way before our time, way back when, because again of the history of of a race in the country. But one thing I want to state clearly, and this I took out of something I read by a Black OBGYN who said she doesn't know how to fix this, but we need to continue having these conversations, is that racism, not race, is what's responsible. Racism, not race. So don't blame Black people for being Black.
Right.
It is,
I love that,
the systems within which we exist. So I just wanted to raise that up for your attention.
I really like that quote, and what you just shared, because I think if we can lean into that, then though it can be a complex, uncomfortable, challenging conversation, it can be had. If you're going at it from a different perspective, particularly where we're talking now in the healthcare system, looking at these biases and stereotypes, and just having that awareness, but also that vulnerability, empathy, compassion for your patients and those that you're caring for, to say, I have a question, I need to, I want to talk to you about, X, Y, or Z, and I recognize these, that there's a disparity here, particularly for women, birthing people, when we're talking about pregnancy and other conditions, but to lean into that and not avoid it.
Yeah.
Right.
I totally agree with that, Talita, and I really want to also say that even the Alaskan Indian and Pacific Islander birthing people are also experiencing, there's even, they're, if not even surpassing, Black birthing people. So that's why I keep using the term, not just Black, but also people of color. But looking at people's humanity, for me, is better than any cognitive skill that you would learn, even after being aware that you have any type of bias. But for this conversation, I'm going to focus on racial bias, because that's basically where we are going here. And you did mention humanity. I want to tell you that I believe it was in 2021, my son, the one that, thank God that he made it and that I made it, had surgery on his knee. He had dislocated his kneecap several times, and the only option was to go do surgery. However, when they went into his knee, they realized that he was born without the groove where the patella is supposed to rest. So a surgery that was supposed to be an hour now ended up being like 3-4 hours. But the surgeon, a Caucasian surgeon, scrubbed out of surgery and came to me in the waiting room and said, Mrs. Williams, things have drastically changed. Your son is okay, but I have to do something different. If not, he's going to be in pain for the rest of his life. I need to create a groove in his knee. And I looked at him. It was a big I mean, I'm a nurse myself, and I walked in the operating room, so I know that here's my son under anesthesia.
Yeah.
And I know he's going to be there for longer, and I know all the implications. So I said to him, I looked at him in his face. I said, if that was your child on that table, what would you do? He looked at me dead in my eyes and said, Mrs. Williams, I will do exactly what I am asking you to do. And then he said, I did not send my physician assistant. I did not send a medical resident that's in that room with me.
Right.
I scrubbed out of, and I know what it means for a surgeon to scrub out of surgery because I worked in the operating room. I know what it takes. It's a lot. But he did. He saw my humanity.
Right.
And I appealed to his humanity at that point in time. And I think, maybe, people may say, oh, things are busy. We have to see all these patients and maybe we have to think in broader terms as healthcare. What do we want? Do we want quality? Or do we just want to, just have patients go through? But this is what it's going to take.
Right.
People need to look at people and understand people. Before I let you go on to your next question, because I know you're itching to move on.
No, I'm not itching.
Okay.
This is like important.
Okay. As I was reading through, some of my documents, I came across this program that was started in Copenhagen, Denmark, in 2000. It's called the Human Library.
Okay.
You can Google it anytime. It's called the Human Library. It's a concept where you can go to different places. It's now, I believe it's in 19 different countries. I just wondered why it's not in the US when I said, oh my goodness. What they do is they have different human beings and they will label unemployed,
Wow.
LGBTQIA, Black, Alaskan Indian Pacific Islander, post-incarceration, substance use disorder, prostitution, and you can rent those human beings. Talita, after here, you can Google it. You can rent one of them and you can sit and talk to them for 20 minutes, for 30 minutes, for as long as you rent them. And after you're done, they go back. And it is to dispel judgment. It is to dispel bias. It is to get people to understand that you cannot judge a book by its cover, that there is so much more to the human being than what you see on the outside.
Now that is incredible.
It is
and that
called
is
the
amazing.
Human Library. Please Google it at some point.
We'll add that to our resource list because that is
It's in 19 different countries, started in
incredible.
Copenhagen
Wow.
in the year 2000. Yes.
We could definitely benefit from that.
Okay.
In the United States.
So maybe you
of
and I just
America.
made news. Breaking
Right.
news.
We need to bring that over here, and I absolutely will Google it to learn more about that because
Absolutely.
that is very necessary to moving the needle when we're talking about bias, stereotypes, racism, and really get into the core of people and humanity. So what not a better way to be able to do that, and also being open and willing to also speak to people about difference and similarities. I think oftentimes when we talk with people, you learn that you are more similar than you are different, if you allow yourself to be vulnerable and to have an authentic conversation.
Absolutely.
Thank you for sharing that.
You're very welcome.
Thank you for sharing that.
You're very welcome.
I will definitely Google that.
Yeah, you should.
Yeah. All right.
I don't know why we don't have it in the US, but maybe you and I can start the Human
Maybe
Library.
we can start that.
Yeah.
Oh, we will look into that.
I
for
think
sure.
so.
Absolutely. All right. Well, then let's shift into community.
Yes.
So we are having a community conversation and talking about Black Maternal Health Week. What are some things that we can share with the community? You had mentioned earlier that, hey, you don't have to have a woman or a birthing person in your immediate circle in your family to advocate, to support. What are some things that we as a community can do? What are some of those danger signs of pregnancy that, if we see someone, might say, hey, might want to get seen?
I appreciate that question, Talita, because this is a problem that I would say we did not create, but it's a problem that needs all hands on deck, right? So and I think it needs to be addressed at all levels, from the personal all the way to the federal level. And I did highlight quite a few things that have been done at the federal level. Again, the Biden-Harris administration have put tremendous amount of resources into improving maternal health outcomes and eliminating the disparities. A lot of money. They released the maternal health blueprints that talked about 5 different pillars, meaning approaching this here and this here and this here and this here. And this is, you can implement this at state level, as local level. The Centers for Disease Control, implemented the Hear Her campaign, where birthing people of all cultures, race, background, can come up and tell their stories. So people can hear them. This is what was going on with me, and I wish someone had listened to me. And some of the stories are good, they're elating, and some of them people would learn, out of from those stories. And the goal is really for us to learn from each other.
Right.
When you listen to me, when you hear me, you can learn from what's going on with me, and then you can intervene better. So on a personal level, and even the community level, I would say for any person who's pregnant, but in the spirit of Black Maternal Health Week, Black people, know yourself, know your own risk factors, know what you can and cannot do, and communicate that with providers, communicate that with whomever. Know your health insurance, know what's available under your health insurance. Do you have access to doula services? Do you have access to lactation supports? What do you have? Do you have access to chiropractors or masseuse? Whatever it is that you need to know about yourself, know and communicate with your providers. Be a partner in your healthcare. And I will say, if you have a provider where you're not seeing eye to eye and you're not getting along, you should make it a point to change. I know it's hard to transition and make changes during pregnancy, but you should. And it is not just that person in the pregnancy, it is the people around you, the community. Begin to get your support group together, right? From where I am from, it takes a village,
right?
When you have baby, when you have a child, you have people cooking and bringing for you. You have people taking the child and helping you. In America, it's different. But you can build that community around you. And also the community should educate themselves as well about, the needs, during pregnancy and during postpartum. Most people think once you have the baby, it's all over.
Not at all.
Not at all, which is why the policy to extend the postpartum period, meaning the time after delivery, up to 1 year, is a great one, because that way the birthing person has access to not only health services, but also to that community coming around you and helping you figure this out. Those are the times that mental health issues may show up. Depression,
correct,
crying all the time, not wanting to get out of bed, not doing anything. And then know the danger signs. There are warning signs. They're all over the place. If you go to the CDC website, it's there. If you Google danger or warning signs for pregnancy, it is there. You know it. The people around you know it. Talita, if you see me, oh, Fatmata, your face looks swollen. My gosh, your arms, your legs. You need to get seen. Even if I don't notice it, somebody else noticed it. If you're having severe headaches, blurred vision, those are signs and symptoms that you need to seek someone.
Right.
Seizure disorder. If you're having seizures, and depression, we have to talk about the mental health issues. Substance use problems. If you're feeling like, my gosh, I'm going to use something, I can't stand this. All of that stuff, bleeding. There's a whole lot out there that people can educate themselves with and know that some of these signs you really need to go and get seen. And the one thing that I'm going to say that I know people like Serena Williams did When you know that stuff about
Advocate.
yourself, advocate and have people who can advocate for you. When Serena went to have her child, I mean, this is all detailed in Vogue magazine. I forgot the year, and she knew that what she had was experiencing, that shortness of breath as well. That's another fast, and shortness of breath. That's another warning sign. She mentioned that she has blood clots. They told her it was the pain medication. She insisted that they do CT scan. They started doing a Doppler. She says, listen to Dr. Williams. That's what she said. Go to Vogue magazine. It's there, or Google it. Listen to Dr. Williams. And when they did the CT scan, she had pulmonary embolism. She had blood clots in her lungs. So they immediately started the therapy. And thank God she was still in a hospital.
Yeah.
Shalon went home, even though she was not feeling good. Right? If you are there and you're not feeling good and they keep telling you go home, you have to be able to advocate for yourself.
Right.
Or someone, please advocate for somebody. So this, I mean, from a community perspective, it is that education and that support, and just, you're the expert on you. You're the expert on you. And there's a point in time when you must assert that. It will be life or death.
I totally agree. You know, that self-advocacy is key to your survival, you know, and having doctors, like you said, that will listen to you and seeing your humanity, and not leaving the hospital if you do not feel well. Your community, your village, your
Correct.
family, knowing and being able to recognize some of these danger signs are all critical to a safe, healthy delivery and pregnancy.
Yeah, absolutely, Talita. I don't know if you had watched the documentary Aftershock that was aired on Hulu in 2023. It's a documentary about a young a lady who died in New York City. Similar circumstance. Her family, her husband, and her mom are all over the country talking about. And it's the same situation when she was experiencing what she was experiencing postpartum. When the EMTs showed up to her apartment in New York, the mother said, they kept asking, is she on drugs? Did she take drugs? They are wasting time trying to figure out whether Shawnee took drugs as opposed to saving Shawnee's life. By the time, so Shawnee died. I mean, so her families, they're now fierce advocates just going around the country and calling attention to this. Again, we are not here saying anybody is bad. We are here saying there's a missing piece here. When people are asking for help.
Right.
That's where the attention needs to be. And how do we get them that help? How do we work together to level this, bring the overall maternal death rate down, but also eliminate the disparities?
It takes all of us.
It takes all of us. It absolutely takes all of us in this conversation. It's work. You know, people may feel defensive. People may not want to admit what's going on. But if you move it from the personal, that, hey, I'm not a bad person here, but I can contribute to the solution. I believe this is why we are having this conversation. It's raising the awareness and providing, whatever we know, whatever we have, so we can continue having this conversation. And by the way, I'm excited about, the Black Maternal Health, Week being celebrated year after year, because I believe it will keep the conversation alive and relevant until we begin to see that, in fact, we're having a material difference. We're making a change.
Absolutely. There's so much that's happening during this week as it relates to advocacy, looking at data, tips and tools, community conversations across the country around this issue, because it does take all of us. It takes a village, and it's hard work. And I have someone in my life, one of my managers from work that says it's hard work, but it's also heart work, right? In terms of looking at compassion, humanity, empathy, it takes all of us.
It's been great.
It's been great. It's been great to be back, to have this conversation, to spread awareness, to inform, to educate, to empower and inspire. It's been wonderful.
It's been wonderful, and I look forward to many more conversations.
Many more conversations. Thank you, Fatmata.
You're very welcome, and thank you.
Thank you. Thank you for joining us, and we look forward to a future community conversation. Take care.
Thank you, everyone. Until next time.